My name is Dr. Molly McVoy. I'm a child psychiatrist practicing in the Cleveland area, member of the APA Council on Communications, and a blogger for Healthy Minds. Anger is a very common human emotion. Everyone experiences it in a wide range. It's a complicated human emotion and can give us challenges if we express too much or too little anger. Both extremes of anger can cause problems for you, can cause problems for the people around you. Too much anger is the obvious problem. It gets you into trouble with your friends, your colleagues, your coworkers. It can end up in fights and saying things that you wouldn't otherwise mean. That's the obvious side of too much anger. However, not expressing your anger or expressing your anger directed at yourself can also cause problems. It can cause depression, can make you feel stressed out, cause problems with sleep, and can often, in the long run, cause as much, if not more, problem than expressing your anger too much to the outside world. So what does healthy anger look like? Well, that's a tough question. The basis for health is if it helps you and doesn't get in your way. So if your anger helps you express what you're feeling but doesn't get in your way, that's the best way to tell if you have healthy anger. If it tells others around you that something is not okay with you, but it doesn't get you into trouble, make them feel afraid, or make you feel upset, that's the best way to know that your anger is healthy, not hurting you. So if you think you have a problem with your anger, what can you do? The first is to notice, to pay attention. When you're feeling angry, step back, pay attention. What's happening in my head? What's happening in my body? How am I feeling? Just doing that is going to take a lot of the power out of your anger. It's going to give you control, give you the chance to look at what's happening instead of the anger taking over for you. Now the other side, if you're internalizing your anger, is a little harder to notice, but it can be just as problematic. Again, the first step is to notice, to pay attention. Do I feel sad? Do I cry when someone else might otherwise be angry? And if you notice that might be you, write it down. Talk about it later. Take any small steps to identify your feelings and express them so that they come out in a healthy way and don't get directed at yourself. So how do you know if this is more than you can handle on your own? If things are getting out of control in your life because of your anger, that's a good sign. If you're in trouble at work, if you're getting in physical fights, if you're hurting other people around you, you might need professional help. In addition, if you ever get so angry or upset that you have thoughts of wanting to hurt yourself, that's a sure sign that someone else, someone professional, could be of help to you. And if you see a psychiatrist, what could we do to help you? There's a lot of things we can do. First and foremost is to figure out where this anger is coming from and what might it be a sign of. Anger can be a symptom of all kinds of things: depression, anxiety, other mood disorders. A professional, a psychiatrist, can help you assess what that's from. Then the next step is how to get best treatment. Sometimes that's medication, sometimes that's therapy, where we can help you learn skills to get better. If you're interested in anger or other topics, anything on mental health, mental wellness, psychiatry, anything we talked about, please go to healthyminds.org.